altmeiertrailers.com. You can trust Altmeier's Western wear and trailer sales.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160. Our conversation with Dr. Nazneen Billimoria brought to you by Marcus & Mack, a law firm representing injured people. Physically distanced all the way off in the corner. There she is. Good morning.
Good morning, Todd. Thank you for having me.
Oh, we're happy to have you. Only very close to your heart, but very close to the hearts of so many people. Breast Cancer Awareness of October, and you and Dr. Clark and the entire staff, this is something that you know is not something to trifle with. This is
cancer, and worldwide it is the leading cause of death in women. In the United States, it's the most commonly diagnosed cancer and the second leading cause of death in women. So it's very prevalent. There's about 2 million cases diagnosed globally, and a lot of those are in the United States.
Let's talk a little bit about the diagnosis of breast cancer and how important it is to catch it as early as possible. And, of course, how much better it is or easier it is to catch it in this day and age.
Yeah. So recently, we've had that around for a few years now, but we are catching breast cancers that previously we weren't able to see on what we call two-dimensional mammograms because we were only getting 2 images of the breast with that form of imaging. But now with the three-dimensional mammogram, we're almost getting slices of the breast moving from top to bottom and side to side. So smaller lesions that were difficult to catch just with 2 better. How 15 years or so, absolutely you need to get your mammograms every year because as we get older, that's when we're more at risk.
We talk about, which is still very, very important to do that self-exam, checking for lumps. But the breast cancer can be there long before you feel a lump.
Absolutely. And actually nowadays with women checking themselves, it is not as recommendation as it used to be. And the reason for that is that, you know, when women do self-exams, the breast tissue itself is very lumpy bumpy to begin with. Mm-hmm. And so what we found is that when women started doing self-breast exams, if they weren't used to it and weren't consistent with doing it, we were doing more biopsies because they felt a lump in their breast, which was probably just normal breast tissue. Mm-hmm. Now, women who are familiar with their breasts and, you know, do them regularly, absolutely, they're encouraged to do that. But women who are not so familiar with their breast tissue, to just do it once in a while is really not recommended because the breast tissue itself is naturally very lumpy. So you're going to feel lumps and bumps that are probably just normal and not a breast cancer.
When we hear of a woman afflicted with breast cancer, quite often it comes with a stage number in front of it. Could you explain that?
Absolutely. So the stage affiliated with breast cancer gives us an idea of how advanced the cancer is. And it's based on 3 factors. Number 1, the size of the tumor. Number 2, whether or not the tumor has metastasized to any lymph nodes. And number 3, whether there is any widespread metastasis of breast cancer, so to other organs like the lungs, the liver, the bone, things like that. So stage 1 is typically where we are catching most of our breast cancers in this day and age. So that means that women have a very small breast cancer. less than 2 centimeters in size, and typically there is no spread to any lymph nodes and definitely no metastatic disease elsewhere. On the other hand, stage 4 is the other end of the spectrum where you have metastatic disease elsewhere, like in the bone, the lung, the liver, things like that.
It's advanced elsewhere in the
Yeah.
body by that point. All right, so let's talk about treatment. That's stage 1, when you catch it as early as you possibly can. What's the treatment protocol? What happens to the woman who is told you have stage 1 breast cancer? Here's what happens next.
Okay, so usually stage 1, so any kind of breast cancer is typically treated with a combination of surgery, chemotherapy, and radiation. In a stage 1 breast cancer, typically surgery will be what comes up first. So that's where Dr. Clark and I come into play, and we talk to women about their options for surgery. Typically for a small breast cancer, most women will opt to have what we call breast conservation. So that means we preserve the entire breast, but we are only removing a lump of tissue that carries the cancer. The other part of surgery involves testing lymph nodes to see whether the cancer has spread there. So once we do surgery and that part is done, the next step comes into play is the oncologist will check to see whether or not chemotherapy is of any benefit to women. And there are certain breast cancers that can be stage 1 where chemotherapy does come into play. So they make that determination, and that's usually what goes next. After they're done with chemotherapy, the last step is radiation. Most women who have had breast conservation, part of breast conservation involves radiating the remainder of the breast to decrease the risk of a recurrence locally. So doing what we call a lumpectomy without radiation is no good because the recurrence rates can be upwards of 20 to 30%. But if you add radiation to a lumpectomy, the result to having, which is why we can offer women with early stage breast cancer now breast conservation.
Okay. I wanted to ask you this. Is there a difference in those protocols for a small-breasted woman versus a large-breasted woman or a medium-sized breast?
Absolutely. You know, if we have a smaller breasted woman, it depends on the size of their cancer. For example, if I have a small breasted woman and she has, let's say, for example, a 2 centimeter nodule in her breast. So I would have to take out a lump that's at least 2 centimeters in size and then take a thin rim of normal breast tissue around that. So to a woman with a smaller breast, that's going to make more of a difference than a woman who has a larger breast and I'm taking out a lump that size and you're not going to see the difference as much. Mm-hmm. So absolutely the size of the breast makes a difference on which way women sometimes decide to proceed. In terms of what we offer, usually a mass that is 5 centimeters or larger, typically those women are going to have a mastectomy. Less than 5 centimeters, the size of the breast does come into play because if I'm taking out, for example, as I said, a 2-3 centimeter mass in a small breasted woman, well, I could be removing near half of her breast volume, as opposed to a large breasted woman where it's not going to make that much of a difference.
I want to ask you about treatment specifically at Indiana Regional Medical Center. With the various advances that you've had in the ORs, I would assume that it is much more efficient and it is much, I don't want to say easier, but you are much more capable now as a surgeon of making this the best result possible.
Absolutely. You know, the nice thing about Indiana is that, you know, we're local here in the community and we have all our resources at our disposal. So starting from diagnosis to surgical treatment to oncology to radiation oncology with our affiliation with UPMC Hillman Cancer Center. In the operating room, I mean, things move exceedingly smoothly. I actually did 2 breast cancer cases yesterday, and both of them went very smoothly. Now, of course, sometimes there's always delays that, you know, are unexpected. But for the most part, they do. So on a day of surgery, a woman will come in, she'll check in for surgery, and then depending on the procedure she's having, most likely she'll have to go down to radiology to get the mass localized, and then also to have the breast injected so that we can identify lymph nodes. Once that's done, she'll come back up to the pre-op area, and then shortly after, we'll take her back to the operating room and do surgery.
Technology, technique, and experience, I would assume, would be great factors in treating breast cancer, and IRMC has that.
Absolutely. Between Dr. Clark and I, we have, now I'm going to age Dr. Clark a little bit here, but we have over 30 years of experience, probably even 40 years, because Dr. Clark is a few years older than I am.
How diplomatic of you. But when you consider the way that the science of it all has moved forward, between the new technology, the new techniques, and the educational process that must be constant for you as a surgeon, it really is a comforting thought to know that you can get the latest in technology and technique and everything in treatment here in Indiana, as opposed to having to go elsewhere.
Yes, you can. Yes, you can. And, you know, a lot of the new advances in treatment, you know, of course they have been in surgery, but that's been for a long time now. For example, the advent of breast conservation versus doing mastectomies on everyone, that's been around for quite a while. More of the advances have been in clinical trials that the larger centers have been able to offer in terms of post-operative chemotherapy, radiation, things like that. Mm-hmm. And with our affiliation with the Hillman Cancer Center, you know, women have access to the clinical trials that patients have access to in Pittsburgh. So they don't need to go to Pittsburgh just to be part of a clinical trial. They can do that here under the care of Drs. Kamanova and Dr. Ramanini, who have been excellent oncologists for our program. And the other thing I wanted to mention, Todd, and I'm not sure if Dr. Clark mentioned it last time, is that pretty soon we're going to be coming up for accreditation as being a nationally recognized breast center. Yeah. So that's very exciting too.
He did, and I imagine he's going to come back at the end of the month and really tout that as well.
Oh, absolutely.
That is such an important designation.
It is. It is. You know, it's a designation that can make women feel comfortable that even though they're getting their care in a community hospital, it is the standard of care. It is nationally accredited, and it's going to be as good as you get if you go to MD Anderson, the Cleveland Clinic, or even Pittsburgh.
It's amazing. She's Dr. Nazneen Billimoria joining us here on Breast Cancer Awareness Month. I want to thank you for coming in to visit with us today.
Thank you so much, Todd.
We appreciate it so very, very much. Our interview, by the way, is available on our Facebook page. It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.